We have a crisis in every community in the state of Indiana in regards to heroin. It's a foregone fact.
Now at 6, state lawmakers say they are making it a priority to pass an emergency bill into law to combat the growing number of heroin deaths in Indiana. Good evening, I'm Heather Herron. This afternoon, the Indiana House voted unanimously to pass the bill that'll make Narcan more accessible to the average person, not just first responders. Narcan reverses the effects of opioid overdoses. News Channel 15's Gina Glaros has tonight's top story. Gina?
Heather, 1,000 heroin overdoses were reversed in Indiana last year. Sadly, one Indianapolis man wasn't one of them. The law named after him, called Aaron's Law, would allow Narcan to be more readily available. The Allen County Coroner's Office estimates there's a heroin overdose every 3 weeks, an increase in years past. Senator Jim Merritt, the bill's author, says usually a new law will go into effect July 1st. But because this is an emergency, it'll begin as soon as the governor signs it.
This is an illness. This is a sickness. This is a disease. This is not a character flaw. One of the issues that we've got to continue to work on in the state of Indiana is addiction, and heroin is the drug of choice right now.
According to a study by the Allen County Health Department, between 2008 and 2013, more than half of people who died by accidental overdoses had someone with them, someone who might have been able to administer Narcan and save a life. Last July, all first responders, including police officers, were able to start carrying Narcan. Now, this law would allow someone to go to a doctor and get a prescription for Narcan to have on hand in case of a heroin or prescription drug overdose. The bill now heads back to the Senate for final approval before going to the governor's desk. Gina Glaros, News Channel 15.